Welcome, everyone. And it's great today to have as our guest Justin Dearborn, CEO of PatientBond. Justin, welcome.
Hey, Mark. Great to be here.
Great to have you. So I would really like to find out more about your company. Why don't we begin there? Tell us about PatientBond.
Sure, great. So at PatientBond, we provide patient and member engagement in the form of a platform, and we use a scientific method for understanding consumers and then really integrating our proprietary psychographic segmentation model and machine learning into a two-way personalized healthcare consumer communication platform. And the platform's designed for a really easy implementation as a standalone or as an enhancement or a plug into a CRM or an EMR platform that a lot of health systems have invested in, of course. And really, we were formed by a number of leaders that came out of healthcare as well as consumer products groups out of P&G. And they saw kind of the rise of consumerism. And it's been talked about for quite a while, obviously, but saw the rise of consumerism and felt they could adapt what they were doing at P&G to healthcare consumers and really adapted the model and built it out for healthcare engagement. And our mission really is to leverage healthcare consumer insights and technology to help our clients build a tighter and better bond with their patients or members to improve health outcomes, increase revenue in some cases, and reduce costs.
I want to ask you what's unique about the company, but even before I do that, if I could have you riff a little bit on the idea of consumerism in healthcare right now. You know, we've been talking about the empowered consumer for literally 30 years in healthcare. I remember writing a cover story about it 30 years ago. What's different now about consumerism in healthcare compared to before? And how do you bring in notions or ideas about consumerism from other industries into healthcare when healthcare is so unusual in certain ways?
Yeah, great question. Really, I think as the internet grew up and apps, everyone's been conditioned to a certain experience and level of self-sufficiency. And some of that applies to healthcare. Clearly, there's that clinical engagement that can't really happen. You still need the clinician involved, but the way that's served up and the way really to interact with folks. You know, I'm a text messenger, for instance. Not everyone falls in that category, but a lot of healthcare is marketed that way as if everyone fits in the same category. So it's really doing the things on scheduling and adherence that we've all become accustomed to, from oil changes to things like that, adapting that. And that's some of the low-hanging fruit. As we go deeper, like at PatientBond, for instance, we'll go into more how to motivate for adherence. So be it meds, be it some care gap closure program you're on, and really driving adoption and adherence to that. But it really starts with, probably overused, but Amazon, Netflix kind of perfected that, very simple to use. And there's certain things that healthcare definitely lends itself to do that way. Others not. It is complex, but there's a lot of basic things that we can drive a lot of efficiency with.
Yeah, absolutely, you can. So what is unique about PatientBond? What differentiates it and positions the company for success in this area?
Sure. So I touched on it a little bit, but we use a consumer science known as psychographic segmentation to personalize the engagement according to a consumer's motivations and communication preferences. And the technology is flexible and powerful enough to handle multiple waves of two-way digital communication with different channel mixes, meaning it can text, email, IVR, human being. And it's really tailored to your psychographic profile. And it's been proven to be highly effective across marketing, clinical, even revenue cycle management. And we consolidate all the patient engagement into one central platform, and really a variety of users, from payers to providers to specialty pharmacy, life sciences companies. So any company within healthcare that really is trying to drive a deeper relationship, and really what that means is adherence and activation, we think we can help with that.
Wonderful. So what are some of the results? Well, first of all, let me ask you how you leverage psychographics to drive engagement. Let's drill a little bit deeper on that.
Sure. So we use psychographic segmentation to group and then target a healthcare consumer. It's according to their attitudes, values, personalities, and motivations. And that's something that really hasn't been done in healthcare. Most healthcare markets or communicates to a one-size-fits-all approach, And that can be effective across a big population of patients or insured members because we're all motivated differently. And it starts with the communication preference all the way down to the content of the communication. And we really get beyond the demographics. So people of the same age group, gender, ethnicity, or even health condition don't act and think alike. And we use a great slide in early sales environments. We have the slide where we show two individuals. We don't show the picture of the name, but we line up some demographics. So these two individuals are same birthplace, residence, age, race, religion, marital status, and then we show the pictures. One's Prince Charles and one's Ozzy Osbourne. So clearly they're going to make different healthcare decisions. They're going to have different things that motivate them and different trigger words. So it's a great illustrative slide of kind of the differences. And right now, a lot of healthcare in they've had is claims data and demographic data, which is great. You need that, but we add that kind of third leg to the stool, which is, all right, now we know this person falls into this range. How do we motivate them to do something? So that's the difference we have. We will basically profile someone and then personalize the engagement. As I mentioned, it comes down to even the frequency, the mode of communication, and then the wording of the actual communication. So, for example, one segment prefers text messages because they're short, sweet, get to the point, not intrusive. Other segments prefer emails because it allows for easy sharing of the information, and there's typically more information or education that can happen there. A third segment wants a phone call, wants it to be more personal and humanizes the message, which is great as long as we know that. So the message needs to adjust to the person's priorities and motivations to really activate that behavior. And we use this approach to achieve great results for our customers, whether again it's for marketing or patient member acquisition or loyalty, or on the clinical side to improve healthcare outcomes, and even on the rev cycle management side.
Wonderful. So tell us a little bit about some of the results you've achieved in that work.
Yeah, so a few that we're allowed to reference, and a lot of these are case studies on our site. But in marketing, we've seen a 50% increase in converting patients to an in-network primary care from frequent ER visitors, which is a big cost for the health system. We've had a 7x increase in telehealth registrations. We've shown a 27% increase in positive Google reviews. And on the health outcome side, which is, I think, personally more interesting to me, we've shown a 90% reduction in unnecessary hospital readmissions for a condition such as congestive heart failure or COPD. We've increased by 8-fold the response among members getting health screenings, which is a big metric for Medicare, Medicaid, and a lot of at-risk plans. We've shown a 28% reduction in health risk for patients receiving health coaching. And then lastly, on the rev cycle side, we've seen a four times increase in patient payments and up to 24% increase in collections for balances over 220 days. That's a metric used in that field. And then lastly, a big reduction up to 50% in paper statements and postage costs to go along with that. So really excited about that. Wish we could talk about more of the results. Sometimes clients are very sensitive to sharing even the good results, but we are allowed to share all these. And again, they're in their white papers and case studies on our site.
Oh, I understand. That's stupendous. That's wonderful. So what does the next couple of years look like for the company?
Yeah, so really continued growth, and current clients should just expect to receive enhancements such as a control center dashboard we released recently, and just higher system reliability and better performance, just normal things that growing companies go through. So all those enhancements hopefully will be seamless and kind of transparent to the clients, but those are happening in the background. And as consumerism continues to grow, and as you mentioned, we've been talking about it for multiple decades. We are also one of the drivers we think also is consumers and some insurance plans are starting to assume costs of greater than 50% of the total cost of their care. So, that's starting to finally drive really closer look and focus from consumers or patients. And they'll expect the same, level of personalization and service that, we've all been accustomed to in other industries. And you are starting to see consumer focused companies like Amazon, who delivers a great experience, where they've started to dip their toe in different areas of healthcare delivery. They see a massive opportunity for improvement, which is something that we see as well. So you are seeing some more CPG and non-healthcare companies come into healthcare, really focus on the engagement piece where they see the ability to really improve performance. And then another topic that's been talked about for a while, but feel like it's coming a little faster now, but value-based or risk-based contracts. So this really requires patient engagement to drive the behavioral change, because a lot of the reimbursement and the cost avoidance is focused on changing outcomes and healthier outcomes for patients. So a lot of that is, I don't say simple engagement, but it really is getting someone to follow the plan. And as health systems go more at risk, becomes a bigger area of focus for them and for the patient on their side.
Well, I definitely see opportunity for organizations like yours, because on the one hand, we're seeing more and more employers placing their employees in high deductible plans. So that will definitely awaken
Right.
the consumer bear, right?
Yeah.
And also, as we move further into value-based contracting, something that we cover all the time on the magazine, health plans, providers, and consumers, suddenly their interests are more aligned, right? It's in everyone's interest for consumers, for patients to be healthier. So I think that what you're sharing is exactly where the industry is going. Any closing thoughts, Justin, before we conclude?
Excited, as I'm sure everybody is. It feels like things are normalizing to some extent. And that's, I think we spoke a while ago. Last year was tough for starting a small business and building a culture and building a team and onboarding employees and onboarding clients when everything is done over remote calls. So we're starting to see that open up a little bit, which I think is great. It's clearly changed for permanently as far as on-site versus off-site interactions, but just for building a company and really delivering value, there's nothing like an in-person meeting to help that along. And so we're starting to see that, again, more normalized and open up, and health systems allowing vendors back on site. So, that's exciting for us and the stage of company we are.
Absolutely. Well, I want to wish you all the very best of luck going forward. This all sounds extremely exciting, and I know we'll be hearing more about your progress going forward.
I appreciate the time today.
Absolutely.
Great talking again.
You too. Thank you so much, Justin. And this concludes the session. Thank you to you and our audience for participating.
Thank you.